Hey everybody, Dr. Ed Gigliotti here. I want to go over a really cool case study that happened here. Somebody with some amazing benefits they received after making specific and scientific upper cervical chiropractic care a way of their life. So remember, when we're helping anybody in here, it's not about the symptoms at hand, it's about function. If the body's functioning the way it should, more specifically the central nervous system that controls all your bodily functions, every process, virtually every process. If that's functioning the way it should, life gets better. Symptoms are all often a byproduct of the body not doing what it should for a very long time. So then the approximately 5 to 9% of your nerves, that small percentage of nerves, are designed to tell you how you feel. Okay? And when there's dysfunction for a long time, a lot of times these symptoms are what will pop up. But that's why at Upper Cervical Chiropractic of Rochester and many chiropractors all across the world, we're looking at function, because function determines on how the body actually is working, right? And if you can get function better, a lot of times we feel better and life gets better. Okay, it changes the whole trajectory of your future. So this here, we took 3D imagings of an individual who came in. This person was struggling for a very long time. Back pain, shoulder pain. Also was struggling with cognitive issues. So memory loss, was having difficulty focusing at work. Word recollection, couldn't remember certain words. I remember when we first helped this person, it was communicating. We had to communicate really slowly so they could process the information we were giving them and then respond accordingly. Okay. So we did a full analysis, and there was some glaring things that we saw right away. So this here is the part of our CBCT technology, the 3D technology. It actually takes X-rays and then creates a 3D image with less radiation than a normal next series of X-rays. It's really cool technology, really cool. So this here is a side view of the person's neck, okay? And this is them just sitting up normally, all right? And as you can see, the teeth are up here. And then look at the curve in their neck, okay? Any medical professionals, which we're blessed to work hand in hand with and help also, will know that the curve in the neck should be a sloping curve towards the chin. That's the way we're designed. It's called the lordotic curve. A lot of times when there's injury and dysfunction, what you'll see is the loss of the curve or a reversed curve. Okay? And in this case, we could see with this person, there's a reverse curve. That's a big deal. Okay? It's not about bone straightening. It's not about, oh, let's make sure all the curves are perfect. It's because when the structure is off, what's affected with the function? You have the C2 vertebra, or the C2 vertebra is about where the brainstem comes through. So the lowest part of your brain comes right through here, okay, the second vertebra. And then it's the spinal cord. So anytime that curve is lost, it's going to put traction, tension, torsion on that brainstem and spinal cord. And how's that going to affect every function in your life, including cerebral spinal fluid flow and blood flow going to and from the brain, supplying the most important organ you have? The only one that's fully encapsulated by bone. That's how important it is, right? So a lot of times when us doctors are looking at this, we could say with a high level of confidence that an injury where you see a reverse curve like this more than probably occurred 15 or plus years earlier. They don't occur overnight. It's especially why it's important to take care of your health, because a lot of times this stuff is occurring underneath our level of awareness. And then all of a sudden symptoms come like abruptly. And we think, whoa, how did that happen? But if you were assessing function, right, like the medical doctor does when they check blood pressure or anything like that, you could see that it was actually, unfortunately, going the wrong way for a long time, okay? The good news is that the body's adaptable and is designed to regenerate. So even though there is limitations to how well somebody can do, depending on how many decades they left it, people do better, which is really cool when you address it. So no fear, okay? So as we saw, there was a reverse curve. And then also what I want to show you here is this is a top-down view. So this is the actual 3D imaging now. So this would be the base of the person's skull. And this is where their chin would be up here. And this is the opening of their skull where that brain is funneling through. Literally the most important 2 inches of our whole body goes through there, because it's our brainstem, right? Like our whole brain is funneling through this area right here. It's this right here we're looking at from the top down. Okay? And if you could see here, check this out. Look at here on how this is the rim of the atlas. And this is a true bird's eye view looking down. Look how big the rim is here, and look how it's disappeared on this right side. The reason is because the atlas has slid over into the right underneath this skull. Think about how much pressure that is. Now remember, all that tissue is snug in here. So if there was an injury like this and it was locked in a malposition, right? How much pressure every split second of the day would be on that delicate tissue that's functioning, it's controlling all function. We're talking cognitive function, from cellular regeneration, immune function, all comes through the brainstem, right? All your pain and sensations, how your muscles fire, how quick your reaction time is, like everything, eyesight, like being able to, the ability to speak, hearing, everything comes through brainstem. It's the relay center, okay? Now, being blessed to care for this person for about 6 months, this actually, we saw changes quicker than we do in the average person. It takes time, right? Time and repetition to get regeneration and changes in the body, especially when it's been there for decades. So we very gently adjusted this person specifically. We actually adjusted their occiput, and then we were adjusting C4, C5, C6, and C7 when it would tell us to, very gently, no twisting, popping, or cracking, okay? And when we did that, this is what happened afterwards. So the first thing I want to do is I want to show the lateral. It was so cool. We were so impressed with this. So that's before. This is after. Look how cool that is. So as you can see, the neck is much more upright now, okay? The neck is much more upright. And you can see also, this is the back of the atlas. I want to show you this here. Look how different it is, how there's a space now. This is before. Look how the space is increasing because the atlas is sitting under the skull better now. And it's opening that canal. So look at the curve restoration. That is so cool. And it's even going to get better. So that's after about 6 months. That's before. How much different do you think that person's function and quality of life would be after seeing a change like that structurally in their body? Right? Now look at this. This is the top-down view. Before. And you could see how that rim was tucked underneath the skull here, right? And look at now. Look how much more balanced it is. Look how much more open the canal is now. Look at that, how you couldn't even see down the canal before and after. How cool is that? So this is what gets us so passionate about this work. And this is why we got to share the message. Because life all happens through your central nervous system. If there's an injury because of a sports accident, even when we're younger, birth injuries, or slips, falls, car accidents, football, right? So big on kids, or banging your head or slipping on ice, right? If that happens and these injuries manifest and they're not addressed, unfortunately, our body's going down a certain pathway. That's why we're so specific and passionate, like I said, about this work, because if we could very gently get pressure off someone's central nervous system and make that a way of life, here or somewhere else, think about where their life is going to go when their body's functioning better. It's going to change the whole trajectory. So love and appreciate you guys. Thanks for sitting with me while I share this with you. I get really excited about this work, if you can't tell. If this resonates with you, you think there's somebody that needs to hear this message, is struggling with health issues, or maybe they're not struggling with health issues, right? And they want to live life better, okay? Because they're not going to wait for the engine to blow to change the oil. We're here. Share the message. We'd love to help. Love and appreciate you guys.